Meet Steve. He is a patient with sickle cell disease. He is at risk of vascular occlusion due to red blood cell sickling and adhesion. Currently, there are no available clinical tests to measure adhesion or determine his risk of vascular occlusion. The functional fluidics solution is: Number 1, predict. Predict the risk of adhesion and vascular occlusion. Select. Select the best treatment for an individual patient. And number 3, monitor. Monitor the therapeutic effect and dosing.
Functional Fluidics is a life sciences and biotechnology company who focuses on mimicking and simulating the blood flow environment.
Consider the magnitude of clotting and bleeding disorders. Each year, more than 600,000 Americans die from abnormal blood flow disturbances. Complications from deep vein thrombosis kill more people each year than breast cancer, motor vehicle accidents, and HIV combined. Factor V Leiden, the most common inherited clotting disorder, affects approximately 5 to 7% of the Caucasian population in the U.S. The sickle cell trait affects people of all nationalities, including an estimated 1 in 12 Americans of African descent and 1 in 100 Americans of Hispanic or Latino descent. Current clinical assays of blood function do not simulate physiologic blood flow. They do not adequately predict bleeding or clotting risk. They are time-consuming, and they require large blood volumes.
By taking blood from a patient, subjecting it to actual blood flow conditions, and then treating that blood with a variety of different therapies, we're able to see how these therapies actually affect the function of blood under physiologic blood flow conditions. This, we believe, is going to be much more predictive of how these therapies are likely to affect the specific patient that's in front of us. The benefit to the patient is that they know they're receiving a drug that, at least in the laboratory environment, has been shown to be effective in their own blood, and it helps us to personalize the therapy that a particular patient is going to get.
Here is an image of blood flowing through a microscopic blood vessel. Functional fluidics takes the blood from a patient and subjects it to physiologic flow conditions to predict how the blood is likely to behave in an actual patient. Blood testing under blood flow may predict the risk of future bleeding or clotting complications, select patient-specific therapy, and monitor response to therapy. Steve is now happy because there is a service that provides the technology to measure adhesion or determine his risk of vascular occlusion. His quality of life has improved. Functional fluidics. Tools to predict, select, and monitor.